This is a short training video about the cervical vertebral maturation staging system. The cervical vertebral maturation staging system has been developed by the orthodontic community and is now widely used in practice to assess timing of the adolescent growth spurt, specifically as it relates to mandibular growth, which can help orthodontists to choose the timing of various interventions that involve growth modulation. It has been shown to have good inter and intra-rater reliability, especially when the raters themselves have adequate training. And it's also been linked to other measures of skeletal maturity, such as the risser stage and the hand bone age independently. In this project, we're going to link it to hand bone age as scored by the standard system, as well as risser staging on scoliosis radiographs with the hand and scoliosis and cervical spine all viewed in a single patient, which has never been done before. So I'm going to give you an overview of the maturation stages that are described so that you can rate the radiographs. There are 6 cervical vertebral maturation stages that have been described, and you can determine them all based on a lateral radiograph looking at the morphology of C2, 3, and 4. So this is an overview of the development of the morphology of C2, 3, and 4, and I'll go through and point out the key phases that you need to be aware of to differentiate between the various stages. So the first step is to evaluate the inferior border of the C2, 3, and 4 vertebra. This inferior border morphology will progress from flat or slightly convex to concave as the patient matures. This specific aspect of the morphology is really only important to differentiate between stages 1, 2, and 3. Through stages 1, 2, and 3, the inferior border of the C2, 3, and 4 vertebra will progress from flat to concave in a fairly predictive pattern. In stage 1, the inferior surface of all 3 of the vertebral bodies is flat or slightly convex. In stage 2, the inferior border of C2 will start to develop a notch or a indentation or a concavity. And C3 and C4 will remain flat or perhaps slightly convex. In stage 3, the salient feature is that C3 will also develop a concave inferior border. So stage 3 is defined by C2 and C3 having a concave inferior border. And C4 will still be flat or perhaps slightly convex. It's important to note that you will sometimes encounter the ring apophysis that will be fused or partially ossified and unfused. When the cervical vertebral maturation system was initially described, they didn't really consider the ring apophysis at all. And so it has been shown, and you'll see in several examples later, that the concavity will develop on the inferior surface of the vertebral bodies sometimes independently of the ring apophyses, but once the ring apophyses fuse, then that concavity becomes very pronounced. But according to the initial description, you're supposed to disregard the presence or absence of a ring apophysis when you assess the concavity or convexity or flatness of the inferior border. So after you've evaluated the inferior border of C2, 3, and 4, so the next step is to evaluate the shape of C3 and C4 on the lateral radiograph. And the vertebral bodies will progress in a fairly predictable pattern from trapezoidal to rectangular vertical, which is defined as the inferior border being shorter than the anterior and posterior borders. And so the stage 1 is defined by C3 and 4 being trapezoidal. And so trapezoidal means that the posterior border is taller than the anterior border, so it's the sloping anterior trapezoid. And it's fairly easy to recognize. Other features that you'll notice in these immature vertebrae that are trapezoidal is you'll see a shadow of the uncinate process that's usually more posteriorly based. And you can see it on this example here. where the uncinate process rises up much higher than the superior border, and then the uncinate process becomes less defined as the vertebra mature. And when you get to the rectangular vertical stage, you can see a little bit of a shadow of the uncinate process, but it's much less defined. And that's technically not a part of the staging system, but it's something that you can see and might help be a tiebreaker between one of the shapes and the one more or less mature to it. So stage 3 is defined as basically by the inferior borders, but you'll notice that one vertebral body may be rectangular horizontal, or both can be trapezoidal, just like in stages 1 and 2. Really, stage 4 is when you need to start paying very close attention to the shape of C3 and C4, because that's how you're going to define what maturation stage you're in. And so stage 4 is defined by both C3 and C4 being in the rectangular horizontal shape. And so that means that the inferior border is longer than the anterior and posterior borders. And sometimes you actually need to measure it out with a little piece of paper to really try to convince yourself which one is longer. And then the progression from stage 4 to stage 5 is defined by one of the vertebra or both of the vertebrae C3 or C4 taking on the square shape. And the square shape is defined as the anterior border being roughly equivalent to the inferior border, or the posterior border being roughly equivalent to the inferior border. It's not really a square. In most cases, it's more like an equilateral parallelogram, and I found that I really needed to measure the anterior and posterior borders with like a piece of paper on the screen, again, to convince myself that it was square. And in some papers, they'll actually define it by measuring the anterior border, and some they will define it by measuring the posterior border. There definitely can be a difference between the two, even when it's not technically in this rounded off trapezoidal shape, because depending on the projection and the rotation, the posterior border can look a lot taller because you can't really differentiate the posterior border of the vertebral body from the uncinate process. So I think that the anterior border is a little bit easier to see in the later maturational stages. And then in terms of defining where you're supposed to measure the inferior border, you're supposed to really take the most prominent points, anterior and posterior to that concave inferior surface. And then for stage 6, C3 and C4 transition to the rectangular vertical shape, and they can both be rectangular vertical, or one can be square and one can be rectangular vertical, but at least one of them has to be rectangular vertical, meaning that the anterior and posterior borders are longer than the inferior border. So just to recap, the progress from stage 1 to stage 6 is defined by the inferior borders of C2, 3, and 4, and then also the morphology globally of C3 and 4. So the first 3 stages you can ignore for the most part, the morphology of 3 and 4, because the key differentiators are the inferior borders. So stage 1 is defined by the inferior borders being all flat. Stage 2, the inferior border of C2 is concave only. Stage 3, the inferior border of C2 and 3 are concave. Now you'll also notice that they're mostly trapezoidal morphologies of C3 and C4 during the first 3 stages. But one of them is allowed to be rectangular horizontal in stage 3. And then stage 4 is defined by all 3 vertebrae having a curved inferior border, and both of C3 and C4 are going to be rectangular horizontal in shape. Stage 5, you're transitioning to square in C3 and C4, but one of them is allowed to be rectangular horizontal. And stage 6, in C3 and C4, you're transitioning to rectangular vertical, but one is allowed to still be square. So a word about the cervical ring apophysis. So as I mentioned before, it's not technically involved in the staging system, but you will see it. And it's interesting. I haven't found it to exactly correlate to the stages. So that's perhaps something for another project. You'll find it ossified but not fused in various stages. And I think some of that might have to do with rotation of the projection of the lateral X-ray. But the concavity is clearly enhanced in the inferior border once the ring apophysis fuses, but it seems to develop even in the presence of an unfused but ossified apophysis. So you're supposed to consider the concavity or the concave nature of the inferior border of the vertebra independent of the ring apophysis. I found some literature on the ring apophysis in cervical spine. Most will have some ossification before age 6, so most of these patients that we're looking at here that are sort of peri-adolescent are going to have some kind of ossified apophysis, and they tend to fuse mostly by 18, but the inferior, specifically the inferior anterior apophysis, has been shown to sometimes be ossified and incompletely fused up to age 20 and beyond. So we'll just go through some specific examples of each stage now. So stage 1 is defined, as I said, by the inferior surface of C2, 3, and 4 being flat or sometimes minimally convex. And then C3 and 4 are trapezoidal, sloping anteriorly. So here's an example of that. And as I mentioned, you can see the uncinate processes, and C3 and 4 are sticking up much higher than the superior surface, the superior end plate of the vertebral body. Stage 2 is defined by the inferior surface of C2 developing a notch or a concavity. And so in this example here, it's fairly subtle. You'll see obviously more defined examples. You can also see a little bit of the ring apophysis, I think, inferiorly on C2 and C4. I can't really see it on C3. But I do think that it's clear that C3 and C4 here are still trapezoidal. And the inferior borders of C3 and C4 are mostly flat. So stage 3, the clear defining line between stage 2 and 3 is that the C3 vertebral body will have a concave inferior end plate. So here in this example, you can see that C2 and 3 have concave inferior end plates, whereas the inferior end plate of C4 is still mostly flat. Morphologically, C3 and 4 are still trapezoidal, but you're allowed to have one of them be transitioning to rectangular horizontal and still be in stage 3. And so of note, this is sort of typically defined as the period of peak height velocity by the orthodontists, and when they're mostly defining peak height velocity, they're talking about mandibular growth. So stage 4 is defined by the inferior borders of C2, 3, and 4 being concave, and both of the vertebra now are rectangular horizontal in shape in C3 and 4. And so in the example, that's the case. They're sort of starting to occupy this trapezoidal shape, which can make it kind of confusing. But if you measure it out, both of these look to be fairly rectangular horizontal. You can still see the ring apophyses actually on C2, 3, and 4 in this example as well. And the uncinate process is sticking up above the superior end plate, but perhaps not so much as in the younger examples. So stage 5, and all the stages beyond this will now have C2, 3, and 4 being concave. But the difference now is really defined by these C3 and 4 morphology changes. And so in stage 5, at least one of the vertebra has to be squared off, and the other one is still allowed to be rectangular horizontal. So in this example, it looked to me like both C3 and C4 were square when I measured them out. Stage 6 is also going to have the inferior border of 2, 3, and 4 being concave, and at least one of C3 or C4 has to be rectangular vertical. And I found that the dividing line between stage 5 and stage 6 was really challenging to determine in a lot of cases, and you had to really very closely measure the anterior posterior borders and compare those to the inferior borders to really determine it. So in this example, I think all 3 inferior borders are concave, and both C3 and C4, in my opinion, looked to be rectangular vertical. But technically in the staging system, one of them can still be square, and you can still be in stage 6.